Thanks for staying with us. Sorry for the protracted wait that we've had to have. Right now, we're looking at NAFDAC urging compliance with alcohol ban. That is the National Agency for Food and Drug Administration and Control, NAFDAC. They have called on manufacturers and distributors to adhere to the ban on alcoholic beverages in sachets and PET bottles. Director General Professor Mojisola Adeyeye, speaking in Abuja, reminded stakeholders that the ban initiated in 2018 involved a phased withdrawal and cessation of registrations. The agency has carried out campaigns and engagements to ensure compliance, underscoring the harmful effects of alcohol accessibility among youths. Professor Adeyeye highlighted the dangers of sachet alcohol due to its affordability and appealed to teenagers, describing its impact as devastating. She reaffirmed NAFDAC's commitment to safeguarding public health by implementing strict regulatory measures to curb alcohol misuse, especially among vulnerable groups. Now, our guest this morning is Dr. Tuyi. Good morning and welcome to the program, Dr. Tuyi.
Thank you. Good morning.
Okay. Yeah, so walk us through the reason behind phasing out alcohol in sachets and PET bottles, just by way of emphasis, please.
Yeah, thank you so much. Alcohol is one of the most addictive and commonly abused substances in Nigeria. Now, the consumption of alcohol increases when it's cheap and there's access to alcohol. Now, the damaging effect of alcohol is dependent on the dose, frequency of intake, and affordability. Okay? Now, what we see in Nigeria is such that alcohol has become easily accessible irrespective of age. And we know the damaging effect from your brain, liver, heart, immune system, concentration, focus. All these things are affected by alcohol consumption. Okay? Now, we found out that we've seen the miniaturization of alcohol production in sachet that people can drink this, throw it away, drink away. First and foremost, it exposes younger people, younger generation to alcohol intake. A large number of young people are taking alcohol. And where are they taking this alcohol? On the streets, motor parks, even every tiny social space we have. You see people hawking alcohol as high as 40% concentration. 40% concentration be hawked, 45% be hawked and sold to people. There's virtually no control for alcohol consumption in the nation. Every small child, every adolescent, every underage have access to alcohol. Even people that are supposed to be off alcohol. It's a big danger because it will come back to lead to increased motor accident, increased violence, damage to organs, and even put more pressure on health infrastructure. So it is important that at this point, we must stop that culture of absurdity where alcohol is given to anybody, anywhere, at any place, and where the dose is not regularized.
Well, I don't know. Is it not a misplaced priority? Don't get me wrong. I'm not meaning this in a derogatory way, but have we looked at the reason why the young people that you're concerned about are even taking the alcohol in the first place? Because it's not necessarily because it is cheap that they're taking it. There's so many other things that are cheap that are not being taken by these people that are giving NAFDAC the concern. Have we addressed this issue before even talking about banning it? Because if I go to a motor park, for instance, or I want to come out early to go to work, and I see alcohol being sold, it's not the youths that wake up to go and drink. It's not the young people, underage people that wake up to go and drink. It's the people who are in the park, the drivers themselves, what we call the agberos and all of that. They are the ones that drink this alcohol. So are we not leaving the root cause of the alcohol consumption and just fighting the alcohol itself? I'm just curious.
Okay, let me clarify that. I won't say let me educate, let me clarify that. Now, the clear thing is simply this, okay? Now, it's not just on the motor park alone that this alcohol are sold. The fact that you're an adult does not mean that you can take alcohol recklessly. The health effect of alcohol would not even, be limited to the fact that, okay, I'm taking this quantity alone. If you are talking about whatever issue is causing people to take alcohol, this issue is not limited to Nigerians. I don't know the issues you want to do. And of course, you have to do a study to provide deeper insight into what you are talking about, that other things that are making people to take alcohol. Because alcohol is addictive, you can as well start giving reasons why people are taking Colorado and all those things and not attack the Colorado, or taking all this combination, maybe tramadol. Say, why are people taking tramadol? Why should we be attacking tramadol and not attack the reason for tramadol? Even if you want to address the reason, you must address the product, because access is key. If you break access, you can break dependence on a lot of things. Access, prevention of access is very key if you want to even address the issues that are making people to take alcohol. So I don't know what the issues could be to you. I don't know. I'm still trying to figure out what could be the reason for me rationalizing the intake of alcohol. Whether I'm an adult or a child. But what we're also trying to do is that when you put alcohol in small quantity like that, it makes it affordable and accessible for even those people that are not supposed to take alcohol. That's one we must stop, right? I'm sure you can't disagree with that. That we don't want people that are underage to take alcohol. We must stop that by ensuring that it is not affordable to them. And I want to ask you the question that you can just again wake up and tell me a country where you divide alcohol into these tiny sizes and give to people on the streets and hawk on the street. There must be a license to sell alcohol, and must be an age limitation to drinking alcohol. I mean, so are you telling me that those people that are hawking alcohol on the street and by the roadside, they have access license to sell alcohol? If you want to really deal with this scourge of alcohol, whatever it is, you have to deal with the supply and demand aspect of it.
Yeah, well, so I'm just wondering why, it's from 2018 that is supposedly the year that registration for these producers of alcohol was, of this kind of sachets or quantities of alcohol, where they stopped registering these people from 2018. And between you and me, you know that there are people who are still producing new brands of this alcohol. Maybe it's the same thing, but with new names and all that. And I'm wondering how far we have gone so far in this fight. Because 2018 to now is about 6 years, and that's not a small thing. So how far are we on that fight against the production of sachet and PET bottles alcohol? Like you said, it's 40%, and in beer, it's about between 5 and 8%. So where are we now on that table?
Now, yeah, I agree. You see, initially, when the NAFDAC mooted the idea of banning production of sachet alcohol, they raised, of course, there was a fight back. Some people, even in the House of Rep, went ahead and tried to even prevent NAFDAC from exercising their lawful duties. That was all, okay? It dragged on for a period, here and there and here, until now. But we cannot just allow, yes, it's 6 years, but again, we have to keep the traction on. We must not justify the consumption of alcohol, the excess consumption of alcohol by any nation. We must not justify it. We must not then say that, okay, it's only adults that are taking this alcohol. For whatever reasons, the health effect is glaring. We see it every time. If you see an alcoholic and you understand the challenges they have to face health-wise, it then feeds back into the health system and causes a lot of problems in terms of health costs and productivity of any nation. So if you want to take alcohol, we always put that label, drink responsibly, and monitor the take of alcohol. Even as an adult, while studying abroad, as an adult, they still demand for my ID card to show my age that I am. So who asks anybody now your age when you want to buy alcohol in Nigeria. So I mean, this if starting point is to buy when it's not available, then you go and buy the big bottle if you want to drink alcohol. Then you can have a way to regulate and ask people how old are you, this and that. The first thing is to stop that production before we now move to the main seller of alcohol and tell them that these are requirements before you sell alcohol to people. If you find out by any means that you sell alcohol to underage and it causes any damage, then you will be liable. So I think all of us should be on the same page in this regard by telling people that there must be limit to supply production of alcohol in tiny quantities that make it affordable to people and accessible.
Yes, like I asked, where are we on this table? Because if you go, I'm not saying it's only the parks. Don't get me wrong, but if you go to parks, because those are the first places that you meet. Maybe at 6 o'clock, shops have not opened. A lot of them open from 8 and above. But as early as 4 o'clock, you can see these things at the parks and roadsides. And I'm wondering why from 2018 that registration stopped and this enforcement was supposed to begin, we're still seeing these things as much as we're seeing. That's why I was asking, why is it that we still have these things so flooding our parks, flooding our roadsides, flooding all other places that they should not be seen? And
it's simple, that's my question. Production is still ongoing. Because production is still ongoing. Because we're not implementing compliance with the directives.
Who are these we? Who are these we? Is it NAFDAC or the people or what? Who are the people who are not complying?
Okay, what happened is that when I say we, I'm talking about the government itself who's supposed to implement.
Yeah.
They're not implementing. Now NAFDAC is giving the final warning that we must start implementing now. The factory will be locked down if you are found producing alcohol in sachet. Your factory will be locked down. You have to be fined. They have to raid people that are selling those kind of alcohol. They have to raid them. So, when we start implementation now, because now when they start doing it, people will be saying that, oh, people must eat, they must supply, it's their means of survival. Now the one is coming up, stop production of alcohol. You can produce alcohol, but produce in a bottle that, that can be monitored, that can have proper warning, in a proper place where it can be dispensed. Those days, even when a beer license, when a beer license is being obtained, when a beer parlor license is being obtained those days, that's why those things apply now. And why are we can't be lackadaisical about it. NAFDAC could go right ahead. For me, I support that NAFDAC should go right ahead to the factories, raid those people that are selling those things in small sachet wherever they find them. Then we know that we're implementing. Then people will now start understanding this.
That's when they know where these companies are, because you and I know that some of these people it's in their backyard they do these things, and maybe that is where the people will have to come in. If you see something, you say something, because NAFDAC cannot be everywhere. But I'm concerned about what you mentioned earlier. When NAFDAC voiced this in 2018, there was a fight back, that's the word you used, even from the National Assembly. Has the National Assembly, or has NAFDAC now had the buy-in of the National Assembly 100%, or are there still bottlenecks in the National Assembly?
I'm surprised the National Assembly is fighting such a noble directive. Why would they fight that noble directive? What are they really trying to gain? Even when people were producing opium, when they were producing opium, when they were producing cocaine, in South America and Afghanistan, people offer them, replacement products. Do you understand? It's not, if they don't produce alcohol in sachets, can't they produce other things that will be useful to people? That's what we're saying. So I don't know why, if not for the fact that I don't want to use the word on air, that they are compromised somewhere at the level of National Assembly, why will anybody obstruct such? In fact, in reality, National Assembly, because they are extant law that stipulates consumption of alcohol, why should National Assembly again be going back and countering those laws? I don't understand. Nigeria is a miracle, it's a challenge for anybody in terms of your thinking. We expect National Assembly to be with NAFDAC to ensure the implementation of this and write to those requisite companies why they have given certain time. Of course, they've given that time to desist and stop production. If your company is hiding somewhere under one room, in one corner producing those things, but you have to give it supply to some people. By the time those people are raided and they are touched, you will also be touched. So I think, honestly, if we understand the danger of alcohol, we shouldn't be having the discussion that alcohol should be produced as it is produced and regulated as it should be regulated. We're not saying you can't drink alcohol. Let's get it straight. Yes, are you of that age? Are you drinking responsibly? Then drink. That's what we're saying. You cannot drink alcohol and I'll give you an insight. It may be a singular experience. My uncle was a professor of pharmacy in University of Ife. He was coming from Lagos to Ile-Ife. He was going from Lagos to Ile-Ife. Got to Alashia in Ibadan. A drunken truck driver killed both of them. Killed both of them more than 20 years ago. It was a big collateral damage to the family. Supposing this guy, of course, must have gotten his alcohol cheaply. Supposing this the supposing this put control without that.
Okay, I really don't know. Sorry for the audio quality there. Dr. Tuyi, if you're hearing me, and I'm hoping that your audio will improve. Even last night, I got a video from a friend where a road safety official was drunk and he was driving. And he hit someone who was just driving in front of him. And when the people, ordinary citizens, met him, they saw that he was drunk. He could not even wear his shirt. He removed the shirt, hung behind him, and then he was thinking, this is a senior officer who could afford to buy this drink from anywhere and all that. And like you said, it's alcohol, and alcohol is dangerous. My question now, if you can hear me now, and I hope that your audio is better now, my question now is that if this thing has to get 100% implementation, what are the things you think that NAFDAC needs to do? And as a follow-up as well, do you think at this moment that NAFDAC is doing enough to educate the people on the dangers of alcohol and the need to fight it? Not just like we're talking on air now. Not everybody will even have the power to see, to watch us on television. Not all of us, all of the people will have the data to watch us online. But how much of this education has reached the people? Is NAFDAC doing enough, or is there another agency that should take that responsibility? Dr. Tuyi, if you can hear me.
Yes, I can hear you. I hope you can hear me also.
Yes, I can.
You are right. NAFDAC is not doing enough, honestly. And the thing is that we should not give the work to NAFDAC alone. What is the local government health department doing about all these things? What are our public health, doing about all these things? What are they doing? Exactly. The question is that what local government, public health, national orientation agency, what are they doing about all these things? What are they doing exactly? So it's not just NAFDAC alone. NAFDAC can spearhead, but we must be able to take the thing down. What are the unions, market unions, National Union of Road Transport Workers and co? What are they doing about all these things? So I think that is where all of us must, we must put, all our hands on deck to ensure that we be able to deal with this scourge. And I must commend, you are doing your own, yes, you have rightly said, but even on the public space, on the big boards on the road, are we doing education? Are we talking to people? Are we communicating the danger of alcohols to them and how to recognize the early warning problems as far as alcohol is concerned? So, it's important. You're right that it is not a NAFDAC work alone. The work belongs to all of us. We've seen mothers who actually fought murder against drunk driving because the mother lost the only daughter to the drunk driver. So all of us, NGO, everybody must be involved, no doubt. But we cannot get our involvement right if we start castigating NAFDAC. Who wants to kickstart such campaign?
Well, I'm in 100% support. A lot of us are in 100% support. We were just wondering because you say, okay, bikes cannot run in Lagos anymore, and swiftly that went. Anything that cannot happen in Lagos, swiftly it goes. And alcohol, since 2018, we've not seen really that the government has shown working. And we were wondering why this is, and we were worried. But now, if NAFDAC is serious about it, I'm sure that they will have the support of a lot of Nigerians to stop these things, especially from, I still keep using motor parks, because if you have a drunk driver so early in the morning, there's danger. There's a lot of danger, and we don't even know where it will lead us to, especially at this point. So if you have a final word, whether for Nigerians or NAFDAC or the government, just say it now as quickly as possible as we wrap up, Dr. Tuyi.
Now, for me, we should help NAFDAC to also disseminate this information. Everybody should be involved. We're not saying that you cannot drink alcohol. Responsible drinking, don't drink when you are driving. Understand the dangers of alcohol. And in reality, ensure that you're having early signs of alcohol addiction. Seek help, seek help. And let me tell you, alcohol also is a porter to intake of so many other drugs. So many other substances. It gets to a point where people mix alcohol with all sorts of things. We have to regulate it. We're not saying stop production. And the company must also understand that we need a healthy population to work in their company. And if they want to produce alcohol, produce in the normal quantity, in the normal bottle, and then so that it can be sold at those areas where it can be monitored. That is my take. All of us must be involved.
Okay. Thank you very much, Dr. Tuyi, for your participation in this program today.
Thank you for having me.
Yeah. We're talking with Dr. Tuyi Mebawondu, who is a public health expert and publisher, Healthnika. And we were talking about production and distribution of alcohol in sachets and PET bottles, and the fact that NAFDAC needs to start reinforcement. But it has to be a collective responsibility of all of us. Some of us may not be there when they're enforcing it, but we know where these things are being produced, especially when they're produced illegally and then flooded in our markets, or they use it to flood our markets and people are buying and all that. The dangers are enormous. Let us preserve our youth. Let us preserve our citizens. Let us preserve our future by making sure anybody who has to drink, drinks responsibly. That's how we wrap up this today's show. We'd like to thank you for being a part of it. Let's connect again tomorrow for another edition. My name is Nyamgul Agaji. Bye for now.